Joining me today to talk about healthy eating in children and especially the impacts of unhealthy foods and drinks on children are Laura Perdue, Nutrition Policy Coordinator with the Minnesota Department of Health, and Mary Schroder, Extension Educator for Health and Nutrition with University of Minnesota Extension. Welcome and thank you both for joining me today.
Hello.
Mary, let's start by talking about why it's so important to focus on providing children with the most nutritious foods possible.
Okay. I'd like to say there's two key reasons why it's important for children to eat nutritious foods. The first is that children need healthy foods for their growing bodies. These foods help give children the energy that they need to grow and play and do all the fun stuff that kids like to do. It also gives children the vitamins and minerals that they need to build strong bones and muscles. And it's also important to remember that this is the time that children's brains are growing the quickest and developing the most. So by eating healthy foods, they're going to get all the nutrients that they need to promote that brain development. The second reason is that in early childhood, by children eating healthy foods, they're going to set up habits for a lifetime. So by eating healthy now, they're going to continue eating healthy as they grow and develop.
Laura, what are the short and long-term impacts of unhealthy eating and drinking on children?
Yeah, well, I think a lot of what Mary said really gets to those impacts. So when we think about children having those healthy habits and growing strong and healthy, lots of times as they, if they're not doing that and not eating healthy as they get older, we're going to see long-term health impacts. It's been found that youth who have just one sugary beverage per day have a 55% greater chance of becoming obese as an adult. And with obesity, it's often linked with a lot of chronic health diseases such as diabetes and heart disease. And we're not just seeing that as youth get older and turn into adults, but we're starting to see that problem more often with them when they're still children as well. We see an increase in obesity in our youth and even diseases like type 2 diabetes, which used to be called adult onset diabetes, now being found in children. And so that's why they changed that name to type 2 diabetes. So there's lots of health impacts that come with those poor eating habits.
Great, thank you. Efforts have taken place in states and cities throughout the United States, as well as in Minnesota, to require restaurants that offer kids' meals on their menus to make the default beverage, the drink that automatically comes with a kids' meal order, to be something healthy like water or unflavored milk. Mary, why do you think those efforts are taking place, and what impacts might they have on children?
Well, I think by serving the milk and water with kids' meals really helps to normalize healthy beverages. If children are getting the milk or water at home with meals, and then also when they're away from home, they're going to start to realize that this is what you have with meals and that they don't need those sugary beverages. And a long-term impact of that is, as we talked about earlier, is that they're establishing that lifetime of healthy habits. And as Laura said, by not having those sugary beverages, they're going to be less apt to be overweight and less apt to develop chronic diseases later in life. Or as she said, too, a lot of them are developing them earlier in life now.
Great. Laura, people have talked for a long time about sugar, sugary drinks, and children. What's wrong with a little sugar or a glass of pop now and then?
Well, there's really nothing wrong with a little bit every now and then, but the problem is that our youth aren't having just a little bit every now and then. They're having a lot and a lot of the time. Recently, my team took a look at the 2019 Minnesota Student Survey, and we looked at questions around sugary beverage consumption. And we found that almost half of the youth in Minnesota are having at least one sugary beverage per day. And the recommendation from experts is that youth have no more than one per week. So one per day is obviously a lot more than that. And that's just looking at the beverages. That's not even taking a look at what sugar our youth are having in food. So it really is about trying to do a little bit less. It doesn't mean that youth shouldn't have any sugar ever, but just cutting it back a little bit.
And the COVID-19 pandemic has dominated the news in everyone's lives over the past year. Is there a tie-in between children and what they eat and drink and the health impacts of diseases like COVID-19?
That's a really good question that I think a lot of people are asking. Since we're still kind of in the pandemic, there's not a lot of data to show what our eating habits are looking like during the pandemic, but some people think that we might be stressed out and eating less healthfully, but we're also eating at restaurants less, so there might be some changes from that. But what we do know is that COVID-19 is really closely linked with poorer outcomes for people who are obese and who have chronic diseases like type 2 diabetes and heart disease. And so what we do know is that if we can have people make healthier eating habits and we avoid those chronic diseases, if we're ever faced with something like this in the future, we might be in a better position to have better outcomes.
Thanks. Any last thoughts or comments?
Yeah, I'll just add that those healthy beverages choices like milk and water are really great ways to get the children the nutrients they need right now for their growing bodies, but it really does help set that foundation for a lifetime of healthy eating.
Great. Well, thank you both, Laura and Mary, for joining me today. For more information on the work being done around healthy foods and beverages in Minnesota, make sure to sign up for the American Heart Association's You're the Cure network at www.you'rethecure.org, or you can text MN to 46839.